Hey everybody, I'm Kimberly Gill. I love bringing you stories on Local 4 News, especially stories about parenting and about women's issues. But I'm coming to you today here on Local 4 Plus because it will give me an opportunity to talk about those stories more in depth without the time constraints of a typical TV news broadcast. So today, we're going to be talking about menopause, and I'll be joined by Dr. Carrie Leff. She's a physician at Henry Ford Health. She's a pediatrician and an internist, and she has a specialization in menopause. So we're going to be talking about all the stigma surrounding menopause, why we don't talk about it, and why we need to talk about it more. So let's jump right in.
I think in order to understand why we aren't talking enough about menopause, we need to talk about the history of menopause and how we got here. You and I were talking when I interviewed you before, and you said that there was a women's health initiative kind of study that had a significant impact on the way women felt about hormone replacement therapy. Tell me about that.
The Women's Health Initiative was a study that was started in about 1991, and actually that coincided, I think, with the first female director of the National Institute of Health.
Yeah.
So, and that is in our lifetime. So I think that a lot of women are struggling with the effects of the messaging that came from the Women's Health Initiative. But in order to really understand the history of hormones, you have to go back actually even further, right? And it's so interesting, I think, when you look at it from a feminist lens, and that's what always really gets me and makes it very interesting and something I want to follow and change, right?
So what we're talking about is there was this best-selling book, and a lot of people read it, and it really set the wrong message. Tell me about the book.
So in 1942, the FDA approved estrogen that could be used as like a pharmaceutical compound. And then in 1960, there was a book called Feminine Forever. And the book Feminine Forever sort of sent the message. It was actually the first time that female like sexual health and sexual response was really out there in like popular culture. So that was sort of transformative. Sure. But the message of Feminine Forever from the author was really that like hormones are going to maintain your youthfulness and your vibrance, and a lot of it was sort of meant to be in the service of men.
Sure.
And
it was written by a man.
More tolerable,
Yeah.
written by a man who ultimately was also being paid by the pharmaceutical industry, by the company that was making conjugated equine estrogen, also known as Premarin. So in the 1960s, after Feminine Forever, like if you were kind of compared, if you weren't on hormones and you were a healthy woman and you were compared to somebody who was going to kind of shrivel up and become irrelevant, like you would want to be on hormones too, right?
Absolutely.
Like, so hormones just soared in popularity, and a lot of women, I don't want to say every woman, but many, many women were taking estrogen, and then it was kind of like it should be in the water, just like we say about sort of other things now. But that,
So the book, because I really want to give people an idea of this book and just how some of the things that are in it. That's really, I can't even believe that this was written. So this author's name was Dr. Robert Wilson. Again, the book is Feminine Forever. He wrote, "Many physicians simply refuse to recognize menopause for what it is, a serious, painful, and often crippling disease." He says, if a woman refused HRT, that's hormone replacement therapy, the consequences would be unthinkable. All postmenopausal women are castrates. This is what he wrote. All postmenopausal women are castrates, but with HRT, a woman's breasts and genital organs will not shrivel. She will be much more pleasant to live with and will not become dull and unattractive. So these were the things that women were reading. This was a best-selling book. And then if you read this, what do you think?
Well, I have never heard that line before, but I'm going to take that piece of paper home. Because if that's the messaging, like you would want that too, right? And so the first thing actually I was thinking about yesterday when we were talking about this is like, you can't have a disease that 100% of women are going through.
It's not a disease.
It can't be a disease. Yeah. It's just like a natural physiologic process or something that everybody's going to cross through. Now, there are points in that sentence that are true, that there are medical consequences to losing your hormones. Now, that does not mean that all women experience menopause the same. Not all women are the same in general, and that's like always a message that I'm trying to send to women. We're not all the same when it comes to our breast cancer risk. We're not all the same in the way we experience pregnancy. We're not all the same in the way that we experience menopause. Sure. And so how can we always make blanket statements about this is true for all women when all women are not in the same pool? So so some of that is correct. It has kernels of truth, right, but it's also wrapped in patriarchal statements, which is really where I take this.
But it's important to talk about this because women were reading this, and then there was kind of like this influx of women that were taking hormone replacement therapy for years, and maybe to the point that it may be a little bit too much.
Right.
And then you fast forward to the Women's Health Initiative study, and they say, wait a minute, we're seeing a link maybe between breast cancer risk and hormone replacement therapy, and then it just kind of shuts down.
Right. So the period after Feminine Forever and before the release of the WHI, I call too many hormones for the wrong reasons, right? Like the fountain of youth and not really related to health, really related to sexuality and attractiveness, right? And I'm a physician, I always tell people, like, I'm here to talk about your health. There's another part of aesthetics, and that's really not my field. So I think that that's important. The messaging from the Women's Health Initiative was really handled very poorly in the early 2000s. And I've recently come to say, like, never before had people been so interested in women's health as when the messaging from the Women's Health Initiative came out really sort of wrong. The news just like jumped on it, and it further perpetuated the myth of things that we've been saying for a long time, that women should be afraid of their hormones, and that we need to stop completely for every woman. Again, right. This blanket statement for every woman doing the same thing, that hormone therapy is not safe for anybody. Right. And after that, not true. Because it's always like figuring out, like, who are you, right? Like, so I don't know, if I don't know anything about you medically, I can't tell you what's good or bad for you. Like, part of having a risk-benefit conversation, and something that we call shared decision making, is to understand what your risks are, health risks based on family history, based on personal history, and then to understand your benefits, right? So if you are having no symptoms of menopause and you only have risks, then that's one thing. If you're having terrible symptoms of menopause, whether you can't sleep and you're having hot flashes or other things that could impact your health, then you stand to gain a lot from hormone therapy. And sometimes we only talk about things really about risk, but doing nothing also has consequences. So we never talk about that either.
That's right. So that's the purpose of the talk today, is that we're going to be talking about actually an opportunity to speak with one of your patients about how using hormone replacement therapy, which we don't call it hormone replacement therapy anymore, we call it what?
Menopausal hormone therapy, because we're not replacing your premenopausal hormone levels. We're not trying to make you feminine forever. We're trying to alleviate symptoms and use it for some protective effects. For example, protective effects for your bones, protective effects for your vagina and vulva, but we're not replacing it so that you feel like you're 20. That's not the purpose.
Right, so changing that language is really important. So I talked to one of your patients, and this therapy is changing her life, so let's listen in.
52-year-old Sharon Jesse noticed she wasn't feeling like herself.
I couldn't fall asleep anymore very well. I couldn't sleep through the night without having to get up and go to the bathroom, forgetting people's names, simple little things. And I was having hot flashes. I had birth control, so I didn't have the symptoms of not having my period, so that never crossed my mind because I didn't have a period.
Her doctor at the time determined she was in menopause, but that doctor didn't offer any options.
I was told to just live with it, that was something that was just going to be my new normal.
And something said, that's not a good enough answer. And what did you do?
Right. So I went to the internet and I tried to find a doctor that specializes in menopause.
That's when she found Dr. Carrie Leff at Henry Ford Health.
Hi.
Yay!
In addition to specializing in internal medicine and pediatrics, Dr. Leff is also a certified menopause practitioner. So you go to your doctor, Dr. Leff, and tell me about that experience.
It completely changed my life. She immediately said, we have answers. We have some options. You don't even have just one option. You have lots of options.
One of those options was treatment for what Sharon described as constantly being hot, something she thought she could just live with.
You know, so many times we just take something and we're like, it's okay. It's okay. I can tough through this. I can wear short sleeves for the rest of my life. No, you know, I want to be normal.
And how do you feel?
I feel amazing. I feel great. I feel normal. I feel like my person, me.
Sharon did a great job speaking up for herself, but when it comes to menopause, many women don't, even though their symptoms interfere with their day-to-day lives. Why aren't more women talking about this? Why didn't my mom tell me? Why did my aunts tell me?
Right. So I definitely think there's like a, sort of culture of secrecy or shame and embarrassment that was present, in decades that came before us. And like, I actually think that now finally people are actually talking about menopause, which is very exciting for me. And we're looking towards like finding the right patients who are appropriate patients that we can prescribe either hormones or non-hormonal therapy, but help to improve their quality of life during perimenopause and menopause.
As for Sharon, she's receiving various treatments for her symptoms. Can your family see a difference? Can your husband see a difference?
Well, I'm sure my husband can. I'm sure my daughters can. I'm not as irritable. Yes, yes.
Will you have this talk about menopause to your daughter? And if so, what would you say?
Yes, I will talk. I talk to the people in the grocery store. I talk to my sister. I talk to everybody about it. I've talked to my mother about it. And, she's, we can just live with it. It's not that bad. But why do we have to live with something that's not that bad? Why? It's a simple solution and we can have a great life still. So I will talk to my kids. I'm sure I'll be talking to them before they need to get to the point where, I'll talk to them.
In Sharon's case, she was like probably a lot of women. She had textbook symptoms of menopause, and then she had some symptoms that maybe were not so textbook, like she was forgetting people's names. She talked about how irritable she was. There are all sorts of symptoms. It varies by person, but the great thing is that it can be helped. She said when she met you, it changed her life. Talk about that. That sometimes we as women think that this is something we just have to deal with, and that's not the case.
Yeah, I think that the thing that I hear as a unifying statement from women that I'm always listening to or listening for is this idea that I started to shift the way I felt about myself, or I started to not feel like myself in my own body at this time between maybe 40 and 50 when my hormones were changing. And they all say it. They just like say it in a little bit of a different way. But they said all of a sudden I just was not myself. My personality wasn't the same. Mm-hmm. I was super irritable, and my husband was like, what's going on with you? Why are you a completely different person? I wasn't able to experience sexual pleasure in the same way that I was before. I was having joint pain all the time, and I was working out before, and now all of a sudden I feel like I can't move in the morning. I mean, you can list 75 symptoms I could probably tell you off the top of my head that all are sort of non-specific and can be related to menopause. Actually, I wrote some of them down for you.
Yep.
I broke them up into categories
great.
because I wanted you to see how expansive these were, and that if you weren't thinking or about menopause,
Sure.
you may not recognize that this would all be put together. So because you mentioned that physicians are really not trained in menopause, and for the last 20 years we've lost complete ground on the training that physicians have had, and so that's part of the medical establishment's issues. But if you listen to these symptoms, they're so vague, and so you may just push somebody off, especially women,
Sure.
especially women of color, right, that tend to be pushed off because they're like, I feel hot all the time, I'm gaining weight, my weight is redistributing from my hips and thighs to my middle, I can't sleep, I'm more anxious, I'm more depressed, I have pain with sex, my libido is bad, my digestion isn't normal, I have headaches, I have brain fog, my memory isn't working, I think I have ADD right now, I have joint pain, I have frozen shoulder, I'm having heart palpitations. My skin is dry. I'm having hair loss. My body odor is changing, and now I'm peeing all the time.
Oh my gosh.
Right.
All of those
I mean, I could go on, but
could
that's
keep
just
going on.
Yeah.
But these are some of the things that you hear when women come into your office and say, you know, what is going on? And then you say, I can help you.
You're perimenopausal or you're in menopause, whatever it is. Some of that is just very validating to people.
Sure.
And they love to share their story. I mean, it's sort of similar to like sharing a pregnancy story or sharing your story about your first period. Like some of it is just validating. And, I haven't been doing this forever, and I have thought of recently the apologies that I need to offer to patients in my past that I didn't recognize were suffering from hormonal transitions. And that's something I've been like learning to contend with, right?
Sure.
Because like even just validating somebody for the way that they feel and that this is non-specific and I get it and I hear you really does help make them feel better.
Absolutely.
In some way.
Before we go on with this, I want to, you mentioned perimenopause for the first time. I think it's important to make the distinction of the definition of perimenopause, because that's something that we're hearing a lot more with social media, I think, and then what menopause is. It's a specific definition for menopause, and that is?
The definition of menopause is 12 months without a period, without any manipulation to your uterus. So that means you have to have your uterus, you don't have an IUD, you haven't had an ablation, you're not on birth control pills. So it's a clinical definition and not defined by hormones levels, defined by periods.
Sure. And then perimenopause
Perimenopause is the hormonal roller coaster. So I usually say that your ovaries shut down in menopause. They stop producing estrogen, but they don't just close the shop like one day. They sputter and they're like, we're going to be open sometimes and then we're going to be closed, but now we're going to be open again this month. And so the perimenopause is the sputtering. It's the erratic estrogen production from erratic ovulation that leads to like a roller coaster of hormones. And that can be a tough experience for some people. So for some women, perimenopause and all the shifts that go along with that are harder.
Sure.
Similar to puberty, right? Like we know and experience like our children's puberty, and we know that their hormones are going to be up and down, and we say, oh my God, they're going through puberty, and we accept that. But we don't have the same language around perimenopause to understand that. And so I think for some women that like haven't had that messaging, that's confusing to them.
Very.
And that's why learning about it can be helpful, because if you even just know that this is something to expect in the same way as you expect your child to be going through hormonal transitions when they're going through puberty, like maybe you'd experience that different. And then for some women, the symptoms with estrogen deficiency postmenopausally can be worse. Everybody experiences menopause and perimenopause differently.
Right, right. But the good news is there are options, and that's what Sharon found when she came to you. Talk about some of the options, because it's not just, I keep wanting to call it hormone replacement therapy, but it's menopause therapy, menopause hormonal therapy.
Yeah, MHT.
MHT.
Menopausal hormone therapy.
Yeah. MHT. Okay, so talk about some of the treatments that are out there. Just name a few.
Well, I guess out there in the public eye, right, people talk a lot about supplements, and there really isn't a ton of good data on supplements that are super helpful in menopause. I think if your symptoms are mild and you try something and it's helpful, then good. The thing that bothers me sometimes about supplements is that women will spend a really long time trying to get benefit from them and then spend a lot of money on them where they don't, and they're not really effective. And part of that is that the medical establishment probably isn't meeting their needs. And then you're going to go on to think about like non-hormonal treatments. And when we talk about non-hormonal treatments for menopause, it's important to understand that those are really very much geared towards treatment of hot flashes and night sweats. Sometimes, especially with some of the new drugs that have come out, they also can help with sleep. But basically, those are treatments that are really targeting what we call vasomotor symptoms of menopause. And then, so there's a new medication that has an on-label indication for treatment of vasomotor symptoms. And then we've been using lots of medications off-label before this new drug came out to treat hot flashes and night sweats. And then hormonal treatments treat the syndrome of menopause. So like I named vasomotor symptoms here, but all of the however many symptoms I named earlier, 25 or 75, only hormones can really kind of address that whole syndrome.
Gotcha.
Right?
Yeah.
So,
Yeah. But there is help, and that's really important. And another big takeaway from me is when I first interviewed you, you let me know that, hey, just because you go to a gynecologist, it doesn't mean that they are specialized in menopause health. And that was actually how Sharon found you, is that, she wasn't really satisfied with the answers that she got from her gynecologist. And she went on Google and Googled, Henry Ford Health, menopause specialist, found out that there's actually a certification that you have that it helps you to keep up to date on all of these latest and greatest things that can help women, right? And if you're at home and you're looking at this and you're going, maybe I'm not getting the answers that I need from my doctor. Maybe I need to talk to somebody that has that specialization. Talk about that.
Well, so that's through the another name change, the Menopause Society at menopause.org, and there's a list of certified menopause practitioners on there, or people just who are members of the Menopause Society, who's really sort of our leading voice in menopause care. I think that gynecologists are fantastic doctors. They also get trained in obstetrics, and a lot of their training is in obstetrics. And many primary care doctors are also very good doctors, but they're just part of a system that's maybe failed women for a little while. It's not necessarily their fault, but it wasn't something that we knew enough about, partially because of funding, which we can talk about, in women's health. And so in order to really understand and know a lot about menopause, like, you kind of need to go on this journey on your own. And that's kind of how I started.
Right.
But it's not something, this is a self-taught thing or
because
self-initiated.
You're not a gynecologist, you are a pediatrician and internist.
Yes.
And then you have this specialization in
Menopause. So this is a journey that I decided to pursue on my own. I mean, through, medical teachings through this organization and other types of certified or CME that we call it, which is medical education. But it's something that I've done post my residency that I've learned it. And so most of the people that decide to do that are really passionate about women's health or about menopause, because they kind of did that themselves too, because nobody was really focusing on this in training, and I hope that changes.
Yeah. Before we talk about the funding, I wanted to get to something else. I love it that you likened menopause to puberty.
Okay.
And you do these talks, these workshops where you call them the Talking Teen, and from that has birthed Talking Teen for Women. Mm-hmm. Talk about how that all came to be and why you started doing that.
So Turning Teen. That's
sorry,
okay.
Turning Teen.
That's okay. Turning Teen is a company that I started probably almost 8 years ago with a fellow pediatrician that I did my training with. And I have 3 daughters. I often talk about them and as being kind of the impetus behind most of the things that I do. And my oldest is going off to college next year. But when she was gonna get ready to go through puberty, I had been hearing a lot of stuff amongst the moms that I, talked to, asking me questions about puberty. And I guess in the same way that we don't learn about menopause in internal medicine or gynecology training, I mean, there is understandings about puberty through pediatric training, but it's not sort of very vigorous, and unless you're an endocrinologist, it's more on abnormal things that happen in puberty than regular sort of run-of-the-mill puberty. So we decided to create these programs to decrease the shame and embarrassment associated with puberty, which is your first hormonal change, right? Hormones are turning on during puberty. And so through that whole adventure and and then listening to women and listening to moms and their daughters' experiences was really transformative for me. And I guess that just in the same way as I started hearing from the moms when my daughter was little, then when I was in my early 40s, I think I would start hearing from my friends, maybe having symptoms of menopause or older friends who are going through menopause. And I just sort of thought, I probably should figure this out before I'm in menopause. So the average age of menopause in this country is 51. So I sort of started on that journey in my early 40s, and menopause was not having a moment at that time. It was not super popular, and there wasn't one moment that I decided that was what I needed to do, but I did start to understand the health effects of menopause, and just so I could be able to provide high quality primary care to women, which has always been my goal. I was I need to learn about this and figure this out. And the timing happens to be really great because there's such so much information coming out for women,
Yeah.
not only through the lay press, but on social media. And that's all kind of coming together just at the right time, I guess.
Well, in which you are an influencer on social media.
Sure.
You'll
Yeah.
accept that title.
I'm gonna take, if you told me that I am, then I am.
You are. You're an influencer on social media. And that also helps, I think, to start the conversation. But first, I want to let people know at home what one of your Turning Teen for Women workshops is like. Let's take a look.
I have lots of passions, but menopause is definitely one of them. And menopause is having a moment, and I'm here for it. So
She calls her seminars Surviving Your Second Puberty, Turning Teen for Women.
what is the name of this area? Raise your hand or just yell it to me. The vulva.
Puberty is when your hormones start working. Menopause is when they stop.
This is all when you're fertile, so between the ages of 12 and a half to 50.
Dr. Carrie Left is an internist, pediatrician, and certified menopause provider at Henry Ford Health.
Those medical questions that your sister asks you, episode 5.
She's also an influencer on social media. Her goal? To get women comfortable talking and asking questions about menopause and letting women know there are options and you don't have to suffer in silence.
What am I hoping she can tell me? I'm hoping that she can tell me what to expect from menopause, what strategies I can use to support any symptoms that I might be uncomfortable with.
Based on the turnout at her latest talk in Bloomfield Hills, women have a lot of questions, and we're not talking about it nearly enough.
There's a lot of confusion and a lot of misunderstanding in the menopause space, and I think her talks are fantastic and really highlight what women need to know.
I came because we spend a lot of time preparing our daughters for puberty. I have a 13-year-old daughter. I've spent a lot of time working with her and preparing her, getting her excited, getting her ready and prepared. And the flip side of that transition is menopause. I'm 42 and I don't know what to expect.
Dr. Left's talks are relaxed, friendly, and informal, covering everything from perimenopause, treatment options, and the history of why our culture has such a high tolerance for women suffering.
Menopause has been something that historically people haven't really talked about. It is having a moment right now, but the more we can hear from professionals and not hear hearsay or what our friends are doing, it's a very individual kind of situation, and to hear from a medical doctor who has a lot of experience with this with other patients is very valuable.
Joining us now is another one of your patients. This is Dana Middlemiss.
Hello.
Hello.
Hi.
Thank you for being here.
Thank you
so
for
you
having
actually
me.
found Dr. Left because one of you took your daughter to one of her workshops.
I did.
Talking teen,
Turning.
teen.
It's a tongue twister.
I know. Turning teen.
Turning teen.
Turning teen
I
workshops.
did.
What was that like? Tell me what you thought. What was
It
going through your mind?
was amazing. I mean, just like Dr. Leff said, I mean, just in my community, you know, moms reached out, and I mean, word traveled fast that one of these workshops was happening, and all of a sudden all of our daughters were getting moody. And it was just a really great environment, first of all, to do something with our daughters.
Sure.
And loved the program, and it really did started a great conversation in a really easy way. Really took down barriers and just uncomfortable conversation, because you know they get squeamish at that age, and so loved that.
Yeah.
It was really, really wonderful. And I was at a time where I wanted to find a physician that could see my kids. I have 2 daughters, and could see me.
Yeah.
And when you find a physician who does both pediatrics and internists, I was reading about Dr. Leff. And just personally, when I read about her specialty and that she's published in, you know, the Turning Teen, and then all of a sudden I was reading about her as a menopause specialist, I just had a moment. I had like the, No way.
So tell me a little bit about your story. You were in menopause or
Oh,
perimenopause?
do we have a 3-day
We got
yeah,
time.
do we have
This is the beauty of Local 4 Plus, is that we have time.
to try to truncate it, I actually went through early menopause. I was 32 years old, and very odd turn of events that I had a 10-month-old in my arms. I had just had a baby. And at that point, I was ready to grow my family at that point, and my body had just, it's textbook. I had 76 symptoms at that point, but I was, we were ready to grow our family again, but my body was acting very odd and really chalking it up to postpartum at that point. But knowing my body at 32. But knowing my body fairly well, I just had a baby, so I didn't think that there would be anything wrong. I just had some symptoms that were odd enough that went to my OB and did some blood work and was told that my numbers, was called, what is it called? FSH, follicle stimulating hormone. So I'm also a student of this at this point. I'm now 53, so I've been managing this, but was told that I was not perimenopausal, I was postmenopausal with a 10-month-old.
What a diagnosis at that time, and you're probably going through all sorts of hormone things related to having a baby.
Yes. So yeah, I'm postpartum, I'm like, "Bleh," and I'm postmenopausal, "Bleh," you know, so very, very shocking news at that point. So now I'm, here I am 20 years later and have been managing menopause, postmenopausal symptoms, and just the rapid, going through menopause rapidly at that age. Before I was on proper treatment, it started with, I felt anxious, depressed, I'm going to say these words, tired but wired. I was like exhausted, but I'd lay in bed wired.
Right. Your thoughts are racing through your head.
Anxious, depressed, tired, wired, lethargic. But I was so young, and until I had that diagnosis, I just really just thought I was anxious and depressed. So I went on an antidepressant first and foremost. Then I thought I had recurring yeast infections because the atrophy, I'm going to say the V word.
Say it.
Vagina.
Yeah.
My vagina was wrong.
Oh my God.
I was just like, I thought I had recurring yeast infections. So I was on diflucan and over-the-counter, yeast and what's it called? Monostat. I just, all the money, all the things, right? So I just was like, I'm just not right and I'm wrong. And all of a sudden I'm gaining weight. I'm not a different person. I eat the same. I exercise the same. And I literally looked at pictures of myself at this time and I'm like, who am I? I morphed into this swollen looking person in pictures until I went on and got a proper diagnosis and then went on hormone replacement therapy and got the right cocktail, I call it, for me. The minute it starts to get into your system and you just get right, all of a sudden I just call it like this glow. And you go in and someone that hasn't seen you for a while is like, wow, girl, what have you been doing?
You got your mojo back.
Yeah, I get your mojo back. You're looking right. Oh, are you in love? Or, what's going on? I'm like,
things.
I am the same person. I still eat the same. I'm moving the same. Still, my life is the same, but I'm right.
At Turning Teen, we talk about this, for our teenagers, and we talk about that your light shines from the inside.
Yes.
And so, what I hear from you when you said this, and I also think that you told me that you were entering into, a new relationship at this time, of your life, too, and you didn't feel like yourself, or you didn't feel right.
Yeah.
And you can say whether your body has changed totally, but it's not necessarily that your body changes totally. It's how you feel inside of yourself and how you carry yourself, and then the light turns back on from the inside.
Yeah.
And then you can do all the things in your 50s, right? Now you're not dealing with your fertility, so you don't have to, you're not gonna be having any more people come into your life. You can decide to focus on your career. You can decide to focus on your family. You can help take care of your parents with more energy than you have. You can decide to take control of your health. Like, there are things, but you just weren't there.
But I call that phase. That was phase one, right? So that was in my 30s and in 40s, and life was good and very happily managed, right? Happily adopted our second child from China, and that's just, again, life's plan. It just, like, wonderful, right? As life goes on, things, change, and then as we go along, working with my OB, my mother was diagnosed and did pass from ovarian cancer, unfortunately, but then, was very proactive, yearly ovarian ultrasound, stay on top of that, got gene testing, just my sisters and I, we were very proactive in that. I'm very involved in my body and my health, and knowing at any risk of that, she had thyroid cancer as well, the benefit risk conversations of all of this. My mom was on hormone therapy as well in her life, but she'd call it, girls, that's my fountain of youth. Like, she would always outweigh the risk and benefit. Again, that was that old thinking, right? But it made her feel good. And but she did call it her fountain of youth. But that was
that's from her, right?
Right.
So,
but that was the dogma. You will be pretty and you will be. Like, that was that dogma. But now, so anyway, I did have ablation when I had a lot going on in my body. So I did have ablation in my younger years, but I did have a mass in my uterus in my late early 50s, and my OB and we had a conversation, and she's like, you have scar tissue from the ablation. I can't go in and do a whatever you would call it, a mastectomy. What do you call it?
Oh, a myomectomy.
Yes, a myomectomy.
Okay.
Right? Yeah. And she's like, at this point, you've been dealing with a lot for a long time, and she's like, I think it's better we get it out and we just take everything out.
So you had a hysterectomy?
Had a hysterectomy a year and a half ago. And I was on a ring that was a systemic release of estrogen that I loved for years. And when I had my hysterectomy, took everything, uterus, ovaries, all of it. So my insurance also alerted me that they would no longer cover that medication after the first of the year. And that would have been 2 months after my hysterectomy. So the hysterectomy, when you get that done, you have to go off hormones anyway. You have to go off all your meds. You have to heal for 8 weeks. Can't do much of anything, no intercourse. You can't be on meds for a little while. And after the hysterectomy, my doctor wanted me to go on an estrogen patch. And we were going to then figure out what's next, since my magical ring was not going to be covered. So then I'm healing from that. I'm not feeling well. I'm not on my magical ring. I'm on this patch that I don't like, because you have to put it on twice a week. It leaves these weird marks of tape on your body. So I'm not happy again. Here goes phase 2. Then I think about Dr. Leff again. I'm like, I'm ready for a physician. Remember that? Because I'm not a sickly woman, so I was going to urgent care if I had a sniffle or whatever. I hate urgent care for me.
Yeah, sure, I get it. Yeah, but
it doesn't work for me. And so I looked up Dr. Leff, and that's where I was like, I just need a doctor who's going to go the distance till the day I leave this earth. Because
I just want to interrupt you here. This is so important. This is very important. I don't know how old you were, but I think that this all plays into women's health, right? You're in these fertile years and you're very focused on or medicine is very focused on what we call bikini medicine, which is your vagina and your breasts until you're done having babies. And so somewhere between 40 and 50, women need to have a primary care doctor that they know and trust. Like the only thing that's 100% certain is that we're all going to have some sort of medical ailment in our life, right? And most of the time that is not involving the bikini areas of our body.
Right.
And so the fact that women for too long like continue to only go to their gynecologists, who are wonderful doctors, but only are
Absolutely.
really caring for those parts, misses the rest of the body.
Yeah. Sure.
And so like this push towards having somebody who that you can form a relationship with as you get older is very, very important. And
It
so I'm so
is.
glad that you did that,
No,
because it's like what you were saying. There's so many ways to patch together your medical treatment through urgent care as if you're well, like Dana. Like she's like lives a really healthy lifestyle.
Sure.
So she's like, well, why do I need a doctor? And the reason that you need a doctor is because you don't know when that thing is going to come, and who wants to meet their doctor in crisis?
Basically, Dr. Leff changed your life in a better way.
Well, she did, because then I go in, I'm in phase 2. After it's been a year and a half since this hysterectomy, guess what? I've gained 20 pounds, same person. I eat the same. However, my joints hurt. My back now has a new issue. I don't feel well. I couldn't get my ring. My doctor tried, my OB tried with prior auths. I'm on this patch. My breasts grew a whole size. I don't feel well. My poor partner, my boyfriend, he's like, oh, my poor girl. Like, I'm not happy. I don't feel well. I'm back to like puffy, swollen. Like, all you poor ladies, like, we don't feel well. We don't feel right. And when we don't feel right, we're not good partners. We're not happy. Like, sexually, I don't feel the same in my body. And it's not like I'm a different person. So I go to Dr. Leff and I share with her what's going on. She's like, I will fight for you for this medication.
Oh, right.
She's like, because over 20 years, you think I haven't tried the 3 things that Aetna's
but
telling
we haven't,
me?
yeah, so we don't have like a way to know exactly like how everyone responds to everything, but she already told me like, this is what I need. And I think I was like, I'll try and do my best and go to the end to you, because I always try to like win that battle for patients, because having insurance companies tell us what to prescribe is super frustrating.
Well, it
and I don't always
is.
win on those, but I think we did like we did something.
We tried
and we
to
did
patch.
get it for you, right?
We tried to patch
and it
for a
wasn't,
while.
She told me it wasn't
I
right.
came in, I'm like, my breasts are on fire.
Oh, right.
You can't even come like
Near me,
me. Like, I can't have a breeze come through. Or it's like, what is going on?
Right.
And, you know, my sisters are like my best friends, and they're like, are you okay? I'm like, no. I have a million beautiful shirts in my closet that I can't even like,
Right.
and they're like, oh my gosh, you poor, like, they know the pain of, I have beautiful clothes.
Right.
I don't even know what to do. I'm about to go get one of those injections that everybody's doing. Like, you know, like the desperation.
glad you didn't do
I didn't do it.
Okay.
So then I go back and I say, I've tried what you said to try first. It's not working for me. And then what my insurance company is telling me that I have to try and fail on, they don't even work the same as what I was on. And you think in the 20 years, I haven't tried that.
Right.
I already did that, and that back when I was 33.
Yeah.
And so it's just a frustration. And so one day, Dr. Leff, at my appointment, she's like, all right, here's what we're going to do. She like goes over, does this. And I'm happily been on my little magical ring.
We got it that
for
day.
4 weeks. Give me some.
There's nothing that really satisfies me more than that. I mean,
I've been
I'm
on it
just
for
gonna be
4
honest.
weeks, and we're getting there.
Yeah.
And I like, all of a sudden I look in pictures, I'm getting there. And I feel like, okay, I see a little bit of the glow back in my skin. I am down 6 pounds in 4 weeks. You know, so I've got a ways to go.
All right, so another thing we need to talk about is funding, because that is something that women's health has not seen the best of, in addition to talking about it. So we're going to take a quick break and we'll talk about that next.
Okay, thanks.
I'm here because I'm standing up for myself. Because I know that when a woman stands up for herself, she stands up for all women. And all women go through menopause. And, you know, we think that this is something that affects just old women. We've been, you know, society has told us when we get to be old, we should just sort of putter away. We should fall off into obscurity and that our issues don't matter. Well, that's just not true.
Well, celebrities are helping to get the word out that not only do we need to be talking about menopause, but we also need more funding for menopause research. And we heard from Halle Berry, who has gone to Capitol Hill to try to rally for more funds. Maria Shriver, other celebrities. Talk about the importance of funding and you know, these celebrities getting behind it helps to bring awareness to it.
Yeah, I think that when we have like shared decision-making conversations and we want to talk about risks and benefits, so often I say to patients, first of all, my patients and patients who come in for menopause are like the most educated and the most informed consumers many times.
Like how we saw Dana. Dana has done so much research.
Crazy good questions that sometimes you want to be like, I don't know, but that's a really good question. Like, let me find out for you. But then a lot of times what I have to say is, I don't know the answer because you're in a data-free zone. I always say that, like, that's a data-free zone. We don't know the answer to that question. And so when we say that a lot, it's kind of frustrating, right? Because that means that we haven't had research to either like to tell you the risks and benefits to that like very pointed and specific question. So I think that funding for women's health is very critical. But I want to go back to history just because, again, that's what's like so interesting to me. Sure. So in the whole time in the 70s, as hormone use was starting to rise, thalidomide use was being used in pregnancy for nausea. And when there were issues with limb defects from thalidomide, the FDA really got scared of doing clinical trials that involved women. So basically after that in 1977, women were excluded from phase 1 and phase 2 trials. And it was supposed to just be women of like childbearing capabilities. But because of this fear and also not being able to account for hormonal changes, in a study, you want everything to be controlled.
Sure.
And because women are cycling and their hormones are different throughout the month, you can't control for those confounding variables. So basically what happened was that this started to apply to all women of even reproductive potential, whether they were on birth control, whether their partner had a vasectomy, whether they had a uterus or not. So basically it was just women were not in clinical trials for many, many years. And in 1993, I guess there was a reversal of this to push all studies to have to include women so that we had more information for women. Because remember that in healthcare, women experience conditions differently than men do. Like, we're not just small men. We're different than men. Like, think about conditions like Alzheimer's, how pain is experienced. Think about that autoimmune conditions are more common in women. And we've just represented women in clinical trials. So we don't have that information. Even women in heart disease, which is probably like the biggest thing that we need to know for women. And so now I guess in 2020, there still is an underrepresentation of women in clinical trials, like still only about 40% rather than 51%, as we're 51% of the population. So it's getting better, but it's not fully transformed. And then we need to have women-specific studies, right, that are looking at all the questions in the data-free zones that we know are not answered. And so Jill Biden was working with Maria Shriver, and they in February passed a bill that's going to give $100 million to research on women's health, but focusing on midlife, which is really exciting, like answering some of our questions about osteoporosis and heart disease, and just collect data about midlife health and with a focus on menopause. And then Halle Berry is sort of rallying the troops for another bill to be passed for $275 million to be earmarked for women's health and focusing on midlife women's health.
Absolutely, because that was after her own experience where she was misdiagnosed and, kind of wasn't getting the answers that she wanted, and she saw a need for this too. So it's definitely something that needs to be talked more about. I'm so happy that we're having this conversation and will spark conversations at home too. Just in closing, what should women be doing? We should be talking about it, but what's the overall advice for somebody at home that's listening to this, hearing one of those 75 symptoms or a couple of those 75 symptoms? What's your advice?
So I guess for me, when I was thinking about that, what I was thinking about is that the first step is really just like getting informed and like understanding, just in the same way as we talk about understanding puberty, how can we understand menopause and how we're going to transition through that change? And you don't know how you're going to experience menopause. Are you going to be one of like the lucky 15% that just fly through menopause without any symptoms? I hope that for everybody. Or are you going to be one of like the 15 to 20% that are what we call super flashers, that have hot flashes for like on the order of 10 years and are very, very symptomatic? So I don't hope that for you. But I think that understanding what menopause is, what perimenopause is, what health risks are associated with your hormonal change, and how you can take care of or take control of your health in midlife is really what I think the best way to start is. And then if you're already there, right, if you're already symptomatic with perimenopause or menopause, it's to figure out how can I find somebody that can help me have that risk-benefit discussion about medication, whether it be non-hormonal treatments or hormonal treatments. So looking for somebody that does have a little bit of extra training if your needs aren't being met, advocating for yourself, right?
Advocating for yourself, so important. Dr. Leff, you've been great.
Thank you for having me.
Thank
This
you.
is such an honor,
Yep,
honestly.
Absolutely. Thanks so much for watching, guys.
Thanks.